everyone, it's Dr. Krupa. Welcome to my Oily Life video. And today I wanted to talk to you about a couple of the most common ways which I use essential oils safely. So first of all, I want to mention that not oils are created equal, and most of you, I'm hoping, know that. There are therapeutic grade essential oils, which are high quality oils, and I suggest that you get to know the company from which you're buying your essential oils. Not all are suitable to be ingested, for instance. Some are not as pure, some are really filled with fillers, and so we want to stick with 100% therapeutic grade essential oils. And I use Young Living so that I trust the company from which I'm buying these oils. So one important tidbit about essential oils is that they're extracted from plants. We say that they are the lifeblood of the plant, and they're usually distilled through steam distillation, and they're very potent, volatile oils, which means they're easily absorbed into your system. Within minutes, they can end up in your bloodstream. And some of them, and they're very potent, which means they're just stronger than herbal teas or tinctures. And I like that. I feel like in this day and age, we need that oomph. We are surrounded with toxicity and all sorts of icky stuff in our environments, hormone disruptors and chemicals and all sorts of stuff. So understand that essential oils are not like herbal remedies or tinctures. They're not like herbal teas. They are much, much more potent, okay? So one of my favorite ways to use essential oils is internally, to ingest them. Again, here, you want to make sure that your oil is therapeutic grade and that it is suitable to be ingested. I use Young Living. I trust the company, and I know that I'm getting the best quality oil. And secondly, not all oils, even though they may be the best quality on the market, are suitable for ingestion, just like not all herbs, right? We can't ingest certain herbs because they're toxic to our body. So for instance, tea tree or cedarwood, some of my favorites, I would use them in specific ways. They're safe to use in specific ways, but not to ingest them internally. But other oils are. For instance, I love clove. Okay, I love clove to boost immunity, to pick up my energy, oral health. I use it as a mouthwash in my tooth. I add it to my toothpaste sometimes. And so one of the ways that we can use clove is to ingest it internally. So I usually get myself some fatty milk, like coconut milk. You can use regular milk, almond, soy, whatever you choose. And I put it in a little shot glass. And I would use about 4 drops of the oil in this, maybe about 2-3 tablespoons of coconut oil, and then I would drink it. I would take it internally. You can put 4 drops, let's say, in some maple syrup and honey. I would not suggest water because usually when it's a spicy oil such as clove, or peppermint even, water disperses the oil. The fat molecules in the milk sort of trap it and put it in a little capsule, and it's not as intense. They lessen the intensity. But hey, if you are out and about, you really need some oil and you don't mind that kick, or for all of us who are used to spicy foods here in New Mexico, chili has burned our taste buds anyway, so what do we care, right? So you can actually just drop this on your tongue and swallow it and down it with some water if you chose to. But fatty substances such as milk help to make it go down a little easier because it's intense. Another way that I like to use essential oils is topically. Okay, so just on your skin, for instance, on your arm, on your neck, on your back, even on your face, and we can use them 2 ways. Okay, so we can apply the oils topically, meaning on your skin, in 2 ways. One of them is to dilute them, and the other one is what we call neat. meaning you just drop the oil on your skin and use it. So I have a little bit of chamomile here, which is a mild oil. I love chamomile, especially for skincare, wrinkles and things like that. And my little one loves the smell of the oil just before bedtime. It's a calming, soothing to the nervous system type of oil. And you could just simply, take a few drops. I want you to see this. This is really neat. This oil is blue. It has this rich blue color. There you go. Look at that. Look. And you would just simply rub it in. You just rub it into your skin. You can rub it in your hands. Inhale it. And it's okay because it's a mild oil. If it was a more spicy oil, such as peppermint, which I use a lot for, let's say, to bring down a fever, or for myself, if I'm, having some shoulder pain, or if I've adjusted to many patients and, my muscles are just screaming at me, then I would use peppermint, but I would dilute it. So here's how to dilute it. In a tablespoon of carrier oil, which could be olive oil, almond oil, sesame oil, any type of oil, you would put about 4 drops in a tablespoon. And that's a very conservative, safe dose. You would put in a tablespoon of the oil, carrier oil, such as olive. I have some olive here that I love. And then you would put 4 drops, mix it around a bit, and then you can distribute it on your skin. Again, the fat molecules kind of trap and help to disperse the oil a little bit better. So another way to use the oils is to diffuse them. You can buy, a diffuser, then you put a little bit of water, and then you drop the oils in there, and the aroma is dispersed into the air. What's interesting is that, whether we put the oils on our skin directly, neat, or we ingest them, or we smell them, they all end up in our bloodstream. So there's not really a better or worse way to use them. They are such small molecules and so potent that they eventually end up in our system anyway. So I want you to play. I want you to experiment. This video is definitely inspired by one of my patients who had a bunch of oils lately but did not know how to use them safely. And so this one's for you. And if you have any questions, by all means, put them in the comments below. And let me know how you're using them in your everyday life. All right, take care. Be well.